Okay, I think we're okay to get started, and people can just kind of catch up as they join. But my name is Andrea Fletcher, and I am a senior program analyst at Dimagi's Boston office. I'm going to ask if everyone can hear me. And I put my email on there as well as our webinars email. So every month we're going to be doing several webinars, at least one overview in English, and then a deep dive into some of the more technical components of ComCare. So this is our first English overview, and then for example, next month I think we're hosting one in French. So if you have colleagues who are interested in joining in French, please feel free to pass them along. And all of our webinars are free. And then we'll also send out the YouTube links afterwards to anyone who missed it. So if you're on our webinar listserv and you can't come to a webinar, you can always watch the YouTube video later. And again, throughout this webinar, feel free to post questions in the chat group. Jeremy Waxman from Dimagi is on there to kind of send you any links that you might need or help you with things like that. So please feel free to begin with that. With questions. So just to kind of get us started today, I'm going to do maybe a 20-minute presentation, no more than 30 minutes, on ComCare and what ComCare is and Dimagi and kind of the role that we play in it. And then we're going to look at an actual app online, a demo application for maternal and child health. So you can kind of see what the platform looks like, and I'll show you what it looks like on a phone. So you can kind of get a general sense of what ComCare is and what it can do. So today's going to be a pretty broad overview, and then we have things like tutorials available online and all kinds of extra materials if you're interested in learning more. And again, we'll be having regular webinars every month on specific topics. And if there's something that you're really interested in learning, please feel free to reach out to us, and I'm sure we'd be more than happy to have a topic based on that. So Dimagi is the social enterprise behind ComCare. So we develop the open source platform, and our mission is to deliver open and innovative technology to underserved communities everywhere. So we do a little bit more than just ComCare. We build some other technologies as well, and we work all over the world. And kind of one of our main missions is to solve this problem. These are pretty common scenes in clinics throughout the world, which is that there are just stacks and stacks of paper with really beautiful data in it, and that data really never makes it out of the clinic. It kind of gets written down on a piece of paper by some really diligent health worker and then put in a binder and stacked up really high. And so our goal is to kind of build mobile tools for frontline workers that do multiple things, and this is where ComCare comes into play. So we build systems for data collection, checklists and protocols, program monitoring and evaluation, client records and tracking, client counseling, and then also SMS or text messaging for performance improvement. So all of these things you're able to do within ComCare, and you can build pretty complex systems with a very simple tool. We have over 300 projects in 40, I think we're actually at 41 now, 40 countries. These are just some of the partners that we've worked with. We've worked with many, many more. And there are many organizations that have never contracted with Dimagi but use ComCare on their own. So either through our community plan or through a paid plan. So there's lots of different options for using ComCare. We also work across many different sectors. So we're pretty well known or scaling in the health sector and the logistics sector. And then we're also, kind of maturing or demonstrating in agriculture and nutrition, financial services for the poor, gender equality and women's empowerment, education and training, emergency response, water and sanitation, and governance and accountability. So if you think about different programs or projects that are happening around the world, Dimagi is not just involved in health and logistics, but across many different sectors throughout the world. So let's just talk about ComCare a little bit generally, and then again later we'll take more of a deep dive in. So ComCare is a platform designed for non-technical users to design and manage mobile data collection and case management projects. Here's a couple screenshot. First of a CMAM app, which is a malnutrition or acute malnutrition monitoring app. And then what that actually looks like to build it online. So you can see a screenshot of we call it the form builder, where you go in and add questions. And then also an example of reports. So here's a submission by form and what healthcare workers or what frontline workers have submitted by each form. So our target users for this are typically community-based project staff in low-resource environments, frontline workers, and organizations managing community-based projects. So this is really targeted towards community outreach. And then the core functionality is that it includes both case management and data collection, but we can also do counseling through the use of images and sound clips and videos. And then we also do worker performance monitoring using some of our reports, and then also things like apps for supervisors. Okay, so what can you do with ComCare? First, you can build or customize a mobile app, and I'll kind of show you a little bit of that today. Then you can also download that app onto a phone. So here's what it looks like on an Android phone, and all of this is customizable. You can move around what forms you want where and what questions you want where. You can even change the beautiful icons that are on there and make them whatever you want. So it's all customizable. And then you can view real-time data in online reports. You can also export all of the data through Excel and CSV. So if you want to use something like data, or we even have organizations that are using Tableau to kind of keep going or get really beautiful data. Great. So ComCare, the mobile solution for frontline workers, this is kind of what you can do on the mobile side. So if you're a healthcare worker or a frontline worker who's out there with a ComCare app, you can use it for complex data collection and to view incoming data in real time on the web. You can also manage your clients. So we call this case management, which is tracking a case over time or a client over time, both on mobile devices and on the web. And then you can engage with multimedia. So images, audio, video, using these kinds of tools to educate and engage frontline workers and their clients. So all of those flip charts that you often see out in the field can be put on a phone. And then you can manage on the website, you can manage the apps and the users. So things like adding new users or seeing how your workforce is performing. You can do all of that on the website, and then you can monitor them. So we call this active data management, which is utilizing the data to focus on performance improvement of your workforce. So noticing that someone hasn't, for example, filled out any forms or has only followed up with 25% of their cases and their target is 100%. So you can do like targeted performance management or following up with low performers to improve their work. So let's just talk a little bit about the impact of this. I think this is pretty important. We put a lot of work into our evidence base. And so here's an example of this, and this is available on our help site. Since 2008, Dimagi has partnered with several top-tier research groups to evaluate ComCare's impact. There's a large evidence base that, again, we have available. You can find it on our help site. So over 20 peer-reviewed publications about ComCare. And we think that we know that it makes us the most evidence-based platform for frontline workers. So please, if you're interested, go and read that. It's pretty exciting stuff, but I'll just share with you a few of the highlights. So when we look at the impact of ComCare, so for access, we kind of look at it in these 4 areas: access, quality, experience, and accountability. But pregnant women have access to ComCare, that have access to ComCare are 20% more likely to access antenatal care and 22% more likely to have skilled deliveries. So that was a study from Afghanistan in 2013. For quality, with ComCare, health workers completed 20% more of protocols and increased their knowledge of health danger signs by 22%. So that came out of both India and Tanzania. And then experience, we've had multiple studies that have said that ComCare improves both the credibility of health workers as well as their engagement with client and family members. Most of this is through multimedia, the fact that they're able to use images and sound clips to actually engage more. And then finally, accountability. So ComCare reduced the average time it took to submit data to a program coordinator from 45 days to 8 hours. So you can kind of see the large impact that we're tracking and that we're able to have on frontline programs. So a big part of Dimagi's philosophy with ComCare is how to develop scalable software methodology and how to take this kind of technology to the masses. So I'm going to talk a little bit about this, and it's a little tricky. It's a pretty high level concept, and so feel free to ask questions. Again, we're trying to have an open space here today. So what makes our technology special? Well, first off, it's open source. So that means that all of our code is actually published online. That doesn't on GitHub. That doesn't mean that the data is open to anyone. The data is only seen by the people who build the project space, so the specific organization. But the code for building ComCare is actually all open source. And then it's longitudinal client tracking. And so this is our case management that we like to talk about, and that we can track something over time, and it can really handle complex workflows. ComCare works offline on the mobile side. So if you're in an area of low connectivity, you can actually collect all of the data and do all the case management offline. And then you're able to also sync with the server whenever you get connectivity. I think somebody's unmuted. I can't tell. Okay, and then we have an app store, or the ComCare Exchange is what we call it, where you can actually go and look at other apps that have been made, and you can publish your app to the app store as well. So for example, if you have the WHO standard Z-scores for malnutrition, we're able to share those with lots of people and work with a standard within a standard format. It's designed for low literate frontline workers. So we've worked with many populations who are low literate, and we use things like lots of images and sound clips. Number 1 is yes and 2 is no, and hashtag is sound clip. They're able to kind of collect really great data and work through that. We also work in non-Roman character script languages, so we can go in just about any language, including things like Hindi or Arabic or Japanese or Chinese, anything that's a non-Roman character. So it's good to know if you're working in multiple languages as well. And we work on both Android and Nokia Java-based phones, so smartphones and then also dumb phones, as I like to call them. And then you can remotely manage workers using some of the reports, and then also you're able to use SMS for frontline workers as well. So I'm going to mute everyone again, but I think someone's unmuted. Hopefully that solved it. Great. So again, Dimagi's philosophy, and these are the last couple of slides on this, but we think there are 3 major criteria for building scalable tech for frontline workers. And all of our software is kind of built around these principles. So we build cloud products that are open source and can address advanced workflows. So a cloud product is a software that is hosted by a provider and made available through a public website. So in this case, ComCareHQ.org is public, and anyone can go and sign up for an account. We actually give you your first 50 mobile users for free. And then after that, it's a $1 per user per month, or a plan system. So you can go and check out the different options there. So examples of other cloud products are Facebook and Dropbox, and kind of any system where you would go online and sign up and store data in the cloud. The software is open source, and that means that it is made freely available and can be redistributed and modified. So if you have software developers available on your team, this makes it easier to transfer the technology to government or local ownership. It's easier for you to set up your own server in country if that's something that you need to do. So really, this is a benefit for projects going to scale. So if you're just running a pilot of 50 users, the cloud product is 50 or less. The cloud product makes that really easy for you to just kind of go on and get started. And then as you're talking to governments or local ownership, open source is a really important concept to have there. And then for advanced workflows, this gives the applications the ability to track people and other entities over time. and includes complex branching logic and rules for parsing and responding to messages. So we can do some really complex referral kind of workflows and interesting things like that. But basically, you know, early on, as you're just getting started, you might just be filling out a few forms or doing some simple data collection and case management. And as you get more complex, you're able to kind of unlock these advanced features and advanced workflows that are critical to your project. So this is what it kind of looks like. And we think that there are some other organizations or other softwares that do some or one of these three criteria, but we're pretty much the only ones that are doing all three. And so just something to think about as you're looking at what's important to you for the software that you'd like to use. Okay, and then I'm going to talk a little bit more. I think Jeremy sent out the link to the evidence base if you're interested in that, but I'm going to go through these last couple of slides on scale and kind of our view on building scalable mobile programs. This was presented by John, our CEO, these couple of slides or something like it at the mHealth Summit in DC this year. And we've been really thinking through a lot of what does it take to actually build a software or a software mobile tool that can go to scale. So we have these three stages. The first stage is demonstration or a proof of concept. So the cloud product, again, this is where it really has advantages. It's a fast startup, low cost. You can kind of do it yourself. You don't need too many technical skills. I'm not a software developer and I build apps all day. So as long as you've got the time and the energy and are able to go through some of the tutorials, most people can get up and running, even if you just come to a few webinars maybe. And then stage two is the iteration and value creation. So this is when you're starting to scale a little bit, maybe to one district or to another program content within your organization. And basically the main advantage of open source here is that you avoid lock-in with one partner. So Dimagi can't really raise our prices too much because we keep our code open source, so it keeps us in check. And it also allows you to work with other organizations or link in with new systems using APIs. And then the cloud product advantage really here is that you get these advanced features that are unlocked or available for you to use. So things like SMS or, again, referral workflows is a really common one, or what's another great example? Supervisor applications. And then it's a lower cost for scaling and iterations as well. So you're able to build most of it on your own here still again, or at a low cost. And then stage three, when you're talking about scaling up and sustaining and improving. So when you're talking about either a district or a national level scale or whatever the scale is for your organization, open source really is the advantage here of having local ownership. So either having local developers involved with editing code or working on the code, or again, using APIs to connect with other systems, and also to take the code and put it on a local server if that's something that you're interested in. And then the cloud product advantage, again, you can still have non-programmers able to maintain applications, and programmers or software developers can be quite expensive. So this helps you keep your costs down over time. Every little change and edit doesn't involve a programmer, and it involves someone who is less technical or kind of a program manager is fine. And then it's proven technology as well. So we're scaling something that has been demonstrated and we don't have to rebuild everything from scratch. So using scalable, proven technology is a really key component of the cloud product. Okay, so I'm going to show you a little bit of our work around the world. Again, that was some really high level information there, but I hope that kind of helps you frame how Dimagi thinks about ComCare and where we're kind of headed with things. And so an example of a few of our projects that we have throughout the world. So in maternal health, we have a lot going on, but specifically Pathfinder International is deploying ComCare to 2,400 health workers in Haiti to register, track, and treat pregnant women. For child health, Paradise Home, or TDH, is rolling out an EIMCI, so an integration, I think it's integrated case management system for child and health. I don't really know what EIMCI means. I should. To 400 health clinics. So this is actually at a clinical management level in Burkina Faso. And this is, again, around referral systems. So they have a pretty fancy app. Nutrition, World Vision has deployed a maternal health ComCare application, the CMAM app, in 9 countries to screen children for nutrition status and related illnesses, plus immunization. And I believe they're rolling out to a few more right now. So that number is going to increase. And then for logistics and supply chain, which ComCare, or ComCare for Logistics, also known as ComTrack, but it's kind of being rebranded right now, so supply chain and logistics for things like management of drug supplies. So John Snow International is tracking medical supplies in 8,600 facilities in Tanzania, Malawi, and Ghana with ComTrack, or ComCare for Logistics. So these are pretty large, if not close to national scale projects, so multiple districts. And then for family planning, the University Research Coalition is using ComCare in Benin to promote family planning and track family planning commodities and pricing. So this is a quite large project as well. And we have many, many, many more projects like this. And many amazing partners. I'm sure some of you have worked with ComCare before, and please feel free to drop in the chat a little information about your project if you're already using ComCare. So a few key ideas or a few key takeaways as we move on and actually look at what ComCare looks like on the website. Our kind of key takeaways today are that ComCare makes data useful for frontline workers and responsible for collecting it. We can also collect data at the point of service delivery. So rather than writing everything down on paper and then aggregating it and having people make many math errors, we can collect it at the point of service. And then off-the-shelf product that takes weeks to deploy instead of years. So we're able to kind of get projects moving very quickly, and typically, Dimagi can deploy within, we say it takes 4 weeks off-site of app development and then 4 weeks on-site. So within about 8 weeks, you can at least have a prototype up and running, a pretty robust prototype. Some people, it might take a little longer. Some people, it might take a little faster. That really just depends on the content of the app as well. And then also no software developers and no servers. So you can use ComCare without hiring developers, and you don't need to invest in infrastructure like servers. You really just need to get some hardware, so a few phones. And then widely deployed and demonstrated, and it's used by over 7,000 facilities and 8,000 community health workers in 40 countries today. So we really, over the last 2 years, we've really gotten ComCare out to the masses, and we're scaling even more and more. So it's a pretty demonstrated technology at this point. And here's just some pictures of people using ComCare and what it looks like out in the field, whether you're using a basic phone or a tablet, or working online, and kind of some of our users, but there's many more pictures on our website, so feel free to go check that out. I've listed a few other resources here, and in the bottom right-hand corner of ComCare, here's a screenshot of it. This is kind of, these are resources that you can find. So we have our website for ComCare, comcarehq.org. We have a help site, which I think you've already been sent a link to. We have a Google group, which you can ask questions to. And so there are these kind of 4 buttons at the bottom. Submit an idea is if you have something that ComCare can't do and you would like to see that. We actually keep track for ComCare of new ideas and implement them. I can't promise that they'll get implemented right away, but they do get added to the roadmap if they're really good or get a lot of votes. We have a voting system for that. So you can submit an idea or vote on ideas that you think are important for new additions to ComCare. You can report an issue. So if you have a bug or need any kind of support in terms of having a problem with something on ComCare, we have a full-time support team. And so you can report an issue to them. You can read our help site. There's lots of amazing material on there on implementing projects and programs. So everything from budgeting and timelines to training materials and some really great things, some really great tools that we've developed and learned For example, having a contract when you hand phones over to users, and there's examples of all of that, and anything we can make available, we do. And then our Google group or mailing list. So we have a community mailing list that if you have questions about an app that you're building, or you just want to tell everyone about your project, or you're looking for solar panels or anything like that, that mailing list is a really great resource to reach out to. And there's a few thousand people on there who will respond. Okay, so I am going to switch over now. This was our workshop today, but again, here's our help site. I'm going to switch over now to the HQ side of Dimagi. And let me answer a few questions first, but we're actually going to look at some of the ComCare HQ stuff. So it looks like JWAX is answering them all. So you're good. We'll be sending out the link and information about the webinar, any kind of materials to the mailing list, which you should all be on if you signed up for the webinar today. But if you don't get it, feel free to reach out to webinars, and it'll also be posted on our YouTube site. So all of it will be freely available to anyone who's interested. I think so that's one answer. For the US, does ComCare meet HIPAA requirements, and could data be transferred from a tablet directly, example by cable rather than the internet? Yes, we have information again on our help site about HIPAA and all of our other international compliances. We are HIPAA compliant. Our cloud server is HIPAA. I believe that you have to be on a paid plan. So you can't be on the free community plan in order to be HIPAA compliant. You have to be at least on the basic pro plans. So that's something to consider. But we are HIPAA compliant. I'll let JWAX answer, Jeremy, sorry, how data can be transferred from a tablet directly without using the internet. You can use Wi-Fi or a data connection through a telecom server. And I know that you can directly transfer it from a tablet. I think it's a little bit trickier than just doing it over Wi-Fi, but I do think it's possible, or it should be possible. Oh, sorry. Okay, great. So what I've got up now is ComCareHQ.org, and I'm logged in. So if you look in the up here right-hand corner, sorry, I'm logged in as Andrea, and you can see there's account settings and project settings. So whenever you go to ComCareHQ.org, the first thing you want to do is sign up for a new account. We're not going to go over that. And then you can see all of my projects, so different project spaces that I'm a part of. So this is the main interface of ComCare. Whenever you log on and click on the applications, so I'll show you our dashboard here quickly as well. So when you log in, this is the first thing that you're going to see. And these are the different options of activities that you can do. So I'm looking at applications that we have available for demoing. And then here's a click for reports. So if you want to see worker monitoring reports, as well as exporting and managing data, managing your mobile users, or web users as well. So you can actually go ahead and add new users or reset passwords and things like that. Here's where you'd configure an SMS if you have messaging available. And again, I think you have to be on at least a paid plan or be paying for SMSs, and that's just because there's a cost associated with those. So if you're interested in SMS, make sure you check out what plans are available. And then the exchange is where you can download and share ComCare applications. So I'll show you that in a second here as well. And then again, settings and our help site. So this is what the main dashboard when you log in. If I click on applications though, and I choose my application, so I've chosen the MVP, the Millennium Villages Project Maternal and Child Health application. And this is kind of what it generally looks like. So here's the name of my app, and I can do different types of settings here. So for example, I'm going to put it on Android. You can have all kinds of information and fancy things going on. And most people, this is fine, just the basic settings. But you should definitely take a look at some of those for your project. So if we go down the tree here, on the left-hand side, the deploy button is how you send it to the phone. Settings, again, basic settings. Multimedia is where you would add things like, or manage your images and sound clips and videos. Languages is where you'd want to go if you have multiple languages. We're gonna look today at the pregnancy module. So here is, we've got, this application is handling pregnancies in children and households. So we've got register a pregnancy, and then a follow-up visit, a close that pregnancy out, so when the baby is born, and then an edit registration. So I'm just gonna walk you through quickly what the registration form looks like, and how you can kind of add questions very easily to that. So here's the pregnancy module. So this is a module, and then the register pregnancy is a form, and this is how ComCare organizes information. So here's the settings for the module. This is where we do all of our case management. So you can look at the case management. It sets a case type as pregnancy and a case list. So again, we'll come back to this after we've done the form quickly, and you can kind of see it. I think I need to. So here's our form. Here's our register pregnancy form. And this is what the form builder looks like. So here's where we add new questions. So we could add different types of questions. A text question, which asks us for basic text. So this could be something like a name. A label allows you to display information. So it wouldn't necessarily ask any information. It might just say, you know, your name is Andrea, or your birth date is you know, whatever. So those are both options. We have two different types of multiple choice questions, one with a single answer. So for example, this mother's date of birth known is a yes, no, so that's a single answer. And then a multiple answer as well. So these are check boxes. So check all that apply. So you can have more than one answer. And with these, when you want to add a choice, this little round button pops up, and that's how we add a choice. So we can add, if we wanted to add another one here, we would add it. For numerical questions, you have integers. So that's just, you know, 1 through, you know, 1 billion, however numbers you want. So any kind of number string. A phone number or a numeric ID actually saves it as a phone number and allows you to put a 0 in front of it. So that means you can actually call directly from ComCare if you have it set as this, or if you have a numeric ID, like a national ID where there might be a 0 in front of it. That's something you would do. The decimal allows you, again, just to have a decimal in there. So this is common for questions asking weight in kilograms and things like that. We could also add ask date questions, time questions, and then date and time questions. So this would just put both the date and the time up there. So, you know, date and time of birth, for example. A hidden value is this X symbol or chi. And this is a really interesting feature of ComCare. So it allows you to do calculations that the user doesn't see. So if we look here, this is doing a date of birth calculation. And I think it's calculating an age or something like that. It says date of birth is not equal to, you know, yeah. So, or an EDD. So this one's calculating the estimated date of delivery. This one is just concatenating or putting together the first name and the surname. So we ask two separate questions, first name, and then we ask family name. And so the full name is actually just putting those together. So we get a really clean name and not something incoherent, I guess. And then these questions here are groups or repeat groups or question lists. So we can actually group questions together. And this is helpful when we're doing some of our display logic. So, you know, for example, I do a lot of HIV work. And if someone is HIV positive, we want to ask them questions about their medications and their CD4 counts and their viral loads. And so we might have a group for HIV positive patients that we wouldn't ask those questions of someone who's negative. And then for a repeat group, we can repeat a group of questions. So this is often used for when we ask how many children are in this household, and then we want to get the name of the child and the birth date. And so we would say there are 3 children, and then we'd ask the repeat group 3 times. A question list allows you to put questions on the same screen on the phone. So for Android phones, this is used to put questions together. Often things like asking questions about drugs and you want different dosages or different amounts. That's a good use. The image capture and audio, I think you can do audio on Java, but I'm not 100% sure. I have to look into that actually. Image capture, video capture, and signature capture can all be done on Android phones. So if you're, signing, you want somebody to sign for something, or you want to take a video, or everybody always wants their picture taken. I think that's one of my key takeaways from training healthcare workers or going out with clients is everyone wants their photo taken as soon as you walk in with a phone. And that's the first thing they want to do. But we can also take images and put them as part of part of the documentation for that case, so we can identify children better, or track something over time, track a wound, track anything a well, really. So outside of healthcare, we use it for lots and lots of things. And then under advanced, we have a few pretty interesting ones here. So GPS, again, only used for Android. So we can collect GPS data points. We can also do barcode scans, which we use, again, lots for tracking logistics, but you can see that useful for other things. You can scan a patient record and pull that up. We can have a password question, which just means as the person's entering it, it has stars, so we have them enter a password for more sensitive information. And then we can also use this thing called an Android app call out. So this is used for several different projects that we have, and this just allows you to customize ComCare a little bit more. So some great examples of this are in Mozambique with the Malaria Consortium. We added a timer for doing respiratory calculations for children. So it's a big green button pops up that says start. And every time the child takes a breath, they tap the big button, and it times it for, I think 60 or 90 seconds, whatever it is. And then it stops and then gives them spits out a number for the child's respiratory rate, and ComCare takes that number and adds it to their case. Another example of this is we work with Biometric or Vaxtrack, an organization that does biometric scanning. We use an Android call out to call into their app to get the algorithm for fingerprinting and then pull that back into ComCare. So we really use this for more advanced applications, but it's got lots of choices. Okay, so that's just going through the top here of all the different question types. And then I'm going to go through this big question properties area here for a few of these questions so you can kind of understand that a little bit better. And then we'll wrap up by actually looking at ComCare on a phone and what that looks like. I'll share with you on my screen. Let me know if I'm going too fast. I think everyone seems to be getting this for the most part, but it can be a lot. So I think, yeah, great. JX got that answered with the SD cards. Okay, so the question properties area has a few key things to note. The first one is that each question has a question ID and a label. So if we start with the top here, the question ID is health_ID, and the label is health ID. So the label is the question, and the question ID is the variable name that you would call that if you're doing data analysis on it. So it's the column title when you export it in Excel. So what it looks like when you export it is you have the question ID at the top and then all the answers underneath it. So the question ID, though, if I try and type it in and I put a space, so if I say health, then I type a space here, it gives me an automatic underscore. So this has to do with data analysis tools and things like that. So it has to have an underscore in it. So just so you know as you're thinking through things. And then the label we can change to whatever we want. What is your health ID, for example, or just health ID, like it was. And then under the logic, there's a few key things here. So this is saying that this question is required. If I check this box, that means that they cannot proceed without answering this question. A display condition is done based on based on a previous question. So I'll show it here with, here we go. So this question here, enter mother's age, is as asked if the date of birth is unknown. So if let's add that expression again. So if date of birth, oh, it's this question. If date of birth, mother's date of birth known, is equal to no, then if this expression is true, then we would display enters mother's age. That's what it's saying there. And you can drag and drop all of that. And then a validation condition. So let's look at this one as well. This one is saying this question, so enter mother's age, is greater than 9. And this question, so the period means this question, is less than 60. So basically, what this is saying is that the mother's age must be between 9 and 60. And the reason that is it's a little odd if somebody were to type in 90, right? And we want to make sure that they're not mistyping in answers, and so we make the validation as strict as possible, so that way they don't accidentally, when they're typing a 20, type 200, and it'll come up as an error. So we're actually cleaning our data as we're entering it. So again, this is age must be between 10 and 15 years old is the message that comes up if someone is out of that range. Okay, let's look at a little more here. Then we also have media. So this is where we can add images, audio, and video, and we can upload them right here. So it says upload image, audio, or video. We're not going to do that right now, but that's where you do it. You can just upload it. You can also do a bulk upload, which is available by clicking on the multimedia. So if you're going to add images for every single question in this form, you don't have to go through and click it. You can actually just do a bulk upload with one folder. Here's kind of advanced stuff. If you're going to do hints, that's a common one. But there, again, that's explained. Anything advanced is explained on our help site. So don't get too concerned with that. The big things that we want to look at, again, are the logic and the basics. So the question ID and question label. So I'm going to look at one more question here, which is the EDD, and walk through the display condition, validation condition again. So this is estimated date of delivery. Again, the question ID is just EDD. The label, so what shows up on the phone, is enter estimated date of delivery. It's a required question. The display condition is that if EDD is known, so this question here is the estimated date of delivery known. So if that is equal to yes, again, let's look at this. We can change it to all kinds of different options. If that is equal to yes, then this question is asked. So if they know their EDD, and then it's got a validation condition that it has to be greater than today and less than 274. So pregnancy lasts 274 days, and it doesn't make sense if your EDD is in the past. It's an expected date of delivery, so we don't want them to enter yesterday, or we don't want them to enter today. If their EDD is today, then we also have a problem. And we want it to be less than 9 months from now. So we're looking at, again, cleaning the data as it's being entered. Okay. I think we're good on these. Again, here's the calculation. So this is a calculation for the EDD, and this one is available on our help site. If you look at the common functions page, it's really helpful. Some of these are just already pre-calculated, things like age and EDD, common use cases. So this one is actually just calculating it in the background. So we use this a lot for again, values that you don't want health workers to see. So EDD is a great example of this, where we can avoid them doing any hand calculations. We do this for all kinds of things. Averages, so like an average blood pressure, if we're taking 3 blood pressures, we can just do the calculation and tell them what the average is. So we eliminate a lot of human error there. Okay. I'm going to check the chat here and see if there's any more questions. I think we're good. Everyone's still with us, so they're not moving too fast. So I'm going to go through what this looks like online, or sorry, on the phone, and then we can come back and take a few more looks at around ComCare and answer any questions that you have about ComCare or using ComCare. I'm going to share, I'm using BlueStacks, which last time I tried to do this on a webinar, it didn't go so well for me. It crashed. So let's hope that it works today. And BlueStacks is a free tool that you can download to demo Android applications. So I'm going to type in my password. I'm using a user called test with a password 123. And when you log into ComCare, this is what it looks like, except for it's on half the screen. So it's not quite as big. So it tells me who I'm logged in as, and I can, if I go up to here to settings, I can do things like update ComCare. So if you want to change a few questions and then have everyone sync with the new version of the app, they go in and they do update ComCare. I can report problems, Wi-Fi direct, which Jeremy talked about, connection tests, all kinds of things. So I'm going to choose start, and I'm going to go into our pregnancy registration. And actually, my sister just had a baby, so we're going to register her. And so I'm typing in, and I swipe across. You can see the progress bar at the top tells us how far along we are. So my sister, Emily, just had a newborn baby. It's pretty exciting. So we'll do her. I think her birth date is, we'll just make it up. Sure, that's something good. Okay, so we can enter a birth date. It's a little tricky to swipe on. Yes, we know her estimated date of delivery. Let's make it a few months from now. Here's her phone number. So here's an example of a validation. It said the phone number must be entered must be 10 digits. So I didn't enter in enough digits. And so it wouldn't let me go through. Okay, so now if we go back in to pregnancy and we do a visit, you can see Emily Fletcher is on there. I can see her phone number, her age, her EDD, her health ID, so all the information that's saved to the case. And so we can go back through and look at case management again after this, now that you kind of see what it looks like. So this is called the case, the screen on the left is called the case list. And that shows all of the multiple people who are in there. So other mothers, their names would show up beneath that. And then the screen on the right is the case detail screen. So this shows me all of the details about a specific case. So I'm looking at Emily, and here's all of her information. Okay, so here are some examples of different questions that are in the visit form now. So I'm just going to run through this one again quickly so you can see how things look. And if we have time at the end, we can go in and look at this form as well. So does this woman show any signs of these emergency symptoms? We're going to give her one. We're going to say that she had blurred vision and severe headaches. So this is a label. Here's an example of a label that pops up, and it says, this woman has a danger sign that requires an emergency referral. Call the emergency number now to transport the pregnant woman to the clinic. And it gives me all of her information there. So if I try to continue, I can, but I can also make this so that way they have to press OK. Did you refer her? Okay, we'll say yes, we referred her. Select the type of referral. We did an emergency ambulance. How's that? Save form and exit. So that's kind of what it looks like. That was a multiple select question. But we could go in and do a couple more as well. Let's actually do a child. Let's register a child. So this is what it looks like when we register a child. We can do a visit with them in this. She had a baby named Evelyn. I'm pretty excited. Birthday was a couple weeks ago. Oh, I don't know what she was in kilograms. We could say 2 of that. I don't know if that might be too much. Okay, so again, if we go into the child, we should see Evelyn come up. So here's Evelyn. And we can, again, go through a visit form. We'll say that she didn't have any of these. But again, the same thing would happen if we checked any of these danger signs. She's been to 1 postnatal visit. Her last recorded weight was 2 kilograms. Let's just say she bumped up to 4. Her weight doubled. We can continue to answer all of these questions. Again, here's all of the vaccinations that they're recording. And then this gives us recommended counseling. But this is just, again, a specific app. You could put whatever you wanted here. Within their logic, they added in recommended counseling on breastfeeding, newborn care, bed nets, and sanitation. And then I could say, oh, I only had time to do these 2, and so that's all I did. And then we can also have audio clips here. Do this one. So that's an example. Obviously, that's not in English, but we can have multiple languages going on as well, both English and then local languages with audio clips and images. Here's a picture of counseling for breastfeeding. So they added in images here. Drinking and eating more, again, so here's an image she used during counseling as well as a sound clip. We can have multiple sound clips and multiple images. Okay, so I think we're gonna look at some of the, we're gonna look at the case management. Now that you've seen it, we'll take a look at it quickly for that pregnancy module. And then we can wrap up again by taking a look at the exchange and then other areas of ComCare that you have specific questions about. But particularly, I think the exchange is a good place for people who are just getting started. Okay, so I'm going to switch and go back. If we click here on the pregnancy folder, this takes us to the pregnancy module. So if you remember, I registered Emily as a case, and then she showed up. So she was a pregnancy type. In the case list, where multiple cases can be seen, this is where we choose what we want. So we had full name, health ID, and health household ID. So here, let me go back to where's BlueStacks? And if we look here on pregnancy and visit, again, this is the case list. And here's my case details. So on the case list, we had full name and the ID. So if we go back and we look at the case details, this was where we saw Emily's, all of her information. So her full name, her ID, her health ID, her EDD, her date, age. And then all of this information gets updated over time. So that's what it looks like in the module level. So you need to configure it in the module level. And then if we look at the form level, so I'm not going to save any changes, but typically you would want to save changes over here in the upper right-hand corner. So if we go back and we look at the form and we click on the form here, this is where we would save any information from a form to a case management. So if you look at the settings here, it says form name. You can actually add logic in for forms. And here's the case management for this form. So this form is adding in, it's saving. So this form is registering a new case. All right. We could also update or close a case and register a case for a different module. So for example, if we wanted to close a pregnancy and ask them, the baby's name and, was the baby born in a clinic, and did they survive the pregnancy, all of that. And then if the baby is born, we register a new child. We could actually do that by registering a case for a different module. So we would just make this register for the child module, and then any child born out of the pregnancies would show up, and we can track their vaccines there. So here we're saving health ID, all of this information, her age, blah, blah, blah. We can actually change the case property name. We can do some fancy things with passing information across forms as well. But this is where that is all done. So any case management information is updated on the form and then tracked again in the module. So let's go back and look at the module. So for example, if we look at the mother's date of birth, DOB, you can see it's updated here. And then if we go to the pregnancy module, here's her DOB calculated. So it's actually using the age calculation and not her date. So rather than saying Emily's date of birth is, whatever, and then I have to look at it and figure out how old it is, it just gives us her age. So this is actually using a calculation, one of those hidden values to show that. Great. Okay, let me take a look at any questions to get us all caught up, or everybody's still with me on this. The last few things I'm going to show you are just the exchange, and then some really fantastic resources on our help site to get you started. But again, please feel free to ask us any questions. Sorry, I wanted to show the exchange first. So the exchange is up here in the upper right-hand corner, or sorry, in the bar at the top. And this is what it looks like, and we can search for different apps. So I showed you today the Millennium Villages Maternal and Child Health application. So you can see it's been downloaded over 1,500 times. It's a pretty popular app for people just to see what's going on or how to use ComCare. And so you can go ahead and download that. If you're into agriculture, this Outgrow or farmer monitoring one is a really great application. I believe if you're doing the Z-scores for the WHO, so calculating malnutrition status of children, both the SNEHA application and the FH application have that in it. Here's a simple ComCare demo or tutorial. So feel free, you can download these pretty quickly. Here's the WHO standards again, and kind of see how ComCare works. Here's an app that we made to demo GPS and how to use GPS. You can also search on the left here if you're looking for specific categories or organizations. You can look over here and search. And we're always excited to have new apps up on the exchange. It's a great learning tool for people trying to use ComCare or getting started. And also a great starting point for organizations who maybe don't have the content available to them, and they need help creating content. It's wonderful to have that shared. So we really encourage people to do that. Okay, so if I click here on the bottom, I can go to our help site. I already have it pulled up. And this is what our help site looks like. Again, we have everything from how to build an application to tutorials and project planning and pretty much anything you could ask for. So I'm going to click on the tutorials and learning tracks because this is one of the great things that we offer, which is being able to be certified. Jeremy actually runs a lot of this, and it's great for if you're looking at what you need to learn in order to be an application builder. And then also the application building tutorial series. So if we look at this in the upper left, here's a beginner tutorial to get you started. So a little bit of what we did today. And there's a whole section on hidden value calculations, so helping you do complex calculations and basic case management. So any kind of basic app building can kind of be learned through this tutorial series. This is actually what we use with our staff on day one. So I think if if we use it to help train our staff who build apps all day long, then it's probably a good starting place for most organizations. Okay, and then I think that's all I've got for today. My last slide that I wanted to show you was about how we have more webinars happening. So let me share this with you. And then we can take any questions. So again, other resources, but thank you all for attending. And we'll take any extra questions that you have now. But please keep an eye out on our mailing list and blog for future webinars, or email webinars@dimagi.com for more information. Our next webinar will actually be on Monday, and it's building ComCare apps and ComCare, or sorry, building mobile apps and ComCare, a deep dive into the ComCare form builder. So we'll go more in depth into just building forms and some of the fancier things that you can do. And then you can always tweet us at Dimagi as well. So thank you all for attending today. Do we have any questions as well? No follow-up questions? Thanks. Okay, we had a couple questions. Might we find certified translators into Haitian Creole? So we can, I'm sure if you email out to our Google group, they'll be able to link you with certified translators. I don't think we have any connections to, somebody at Dimagi might, but we don't necessarily link organizations up with translators. But if you email the Google group, you should be able to find one through there, or at least somebody might know of. Can ComCare be used in a simplified version on non-smartphones, like a basic Nokia? Sorry, that was a private message, but yes, it can be used on a Java-based phone. So the Nokia C2 used to be the phone that we recommended, but if you look on our help site, and maybe Jeremy can send that link, we have recommended Nokia phones that are available. Can you show us what it looks like on an actual phone? So what I was showing you on BlueStacks is what it looks like. If you have an Android phone available, you can just download the app that I showed you, which is the Maternal and Child Health app from MVP, and go ahead and put that on a phone for yourself. So you can actually demo it for yourself. But the BlueStacks that I showed you is a projection of what it looks like on an Android phone. So you can do different ones. And then again, thanks for sending that out, Jeremy. There's a few videos on our website as well, of people demoing different applications. One final thing I think I'll send out as well that's good to know is our pricing options and kind of what that looks like for ComCare, just as you're budgeting. Trying not to be too sales pitchy here, but Dimagi does have both service plans and software plans. So some of the features that we mentioned, like messaging, you have to have a paid plan. And then if you don't have the technical capabilities, Dimagi has service plans, and we also have pro bono for our software. So if you think that your organization just can't afford $100 a month, you can apply for a pro bono plan. And we're pretty willing to work with people on some of this, or work with organizations. And then also we have our service plans, which are available and you can look at it online. And this is if you need help, mostly with either something customizing, or help building your applications. The cost of using the server is included in the plan. So if you look at the software plan link that I sent out, anybody can use the community plan for free for up to 50 mobile users. And then after that, it's $1 per user per month. And that gives you all of your access to the application builder and data exports. So all of your data is stored on the cloud for free. If you want things like, again, SMS or customized reports or access to APIs, then you have to be on at least the $100 a month plan or the standard plan. And so that gives you extra features. And then also so things like messaging and a little bit more support as well. But everybody can use our free community support. And then if you have special needs, we can go up to like an enterprise plan, which we have several organizations on, and that they're running applications in multiple countries and things like that. Yes, we'll be sending out a recorded presentation. I think everyone's pretty excited for that. Great. Any final questions before we wrap up? Again, feel free to email webinars at Dimagi, or you can email myself, Fletcher@dimagi.com. We're happy to kind of answer any of your questions or help you as you're thinking through designing your program or project or getting things started. And again, our next webinar is on Monday, and then I think next month we'll be sending it out shortly. We'll be hosting one in French, and then this one again. So if you have colleagues who you think should kind of come and learn a little bit about ComCare, we'll be running a monthly one in English. So we're happy, at least for the next couple of months, we're happy to take whoever you recommend to us, and they can just drop in for an hour and listen. And then we'll be doing a technical deep dive. So again, Monday is on the form builder and learning more about how to use the form builder. Okay, I think we're done for today then. Thank you all for joining. I'm going to sign off.